Okay, yes. Today we are going to talk about anxiety disorders, and specifically we are going to look at separation anxiety disorder. So, according to DSM-5, which is the diagnostic manual for all disorders, anxiety disorders usually include those features of excessive fear and anxiety and normally behavioral disturbances. So, fear is the emotional response to a perceived imminent threat or danger to the physiology of the body, whereas anxiety is the anticipation of future threat. So, what is really the separation anxiety disorder? So, one can tell with certainty that somebody is experiencing separation anxiety when there is developmentally inappropriate excessive fear or anxiety concerning separation from those to whom the individual is attached. Now, there has to be a number of criteria that will be exhibited by the individual so as to one can give proper conclusion that this individual is really suffering from separation anxiety. And one of them would be recurrent excessive distress when anticipating or experiencing separation from home or from major attachment figures. So you can tell if a parent is leaving home using the behavior of the child. Is the child clingy? Are they okay with their mother going away or their father going away? Or are they worried all of a sudden? Do they run and hide in the car, or do they follow them as they go towards the exit of the house? Yeah, that could be notable. Also, when there is persistent and excessive worry about losing major attachment figure, when a child repeatedly worries about the death of their parent, that could be one sign of separation anxiety. And also, when there is persistent or reluctance of refusal to go out from home or to school or elsewhere because of fear of separation. This child doesn't, if you want to send this child to the shop and they don't want to go because they are afraid when they come back they will not find the the attachment figure, the caregiver, the mother. So these are the pointers into which one can conclusively say that there is a separation anxiety. More of these criteria would include persistent and excessive fear or reluctance about being alone or without major attachment figures, persistent reluctance or refusal to sleep away from home or go to sleep without being near a major attachment figure. So, the parent wants to send this child to bed, and this child doesn't want to go to sleep alone. They want to tag their mother along because they are afraid of the dark, but they are simply afraid of um, not being near the attachment figure. In this case, the mother or the caregiver. Then there is also the case of repeated nightmare about the theme of separation. This is when the child would probably wake up at night and call for the name of their mother or the caregiver. Uh, Not to construe that as a nightmare, which normally occurs in sleep, but also as a point that this child is afraid that while they sleep, the caregiver might go or might leave them. Then also repeated complaints of physical symptoms, headache, stomach. You know, this is when the mother wants to go to work or the dad wants to go to work, and this child all of a sudden complains of ailments. How they say they have headache, they all of a sudden develop some stomach ache. This is not because there is real illness, but it's because this child wants to draw attention that they are not comfortable being left alone by the caregiver or by the attachment figure who could be the parent. So how do we tell if for sure these criteria which are exhibiting maybe more than 3 are a form of separation, or are they pointers to the separation anxiety conclusively? This can only happen if in 4 weeks in children and 6 months in adult, if there is persistent and consistent fear, anxiety, or avoidance. So if a child behaves in this manner for more than 4 weeks, then one can conclusively say this child is having separation anxiety. And then now, for the same case in adults, if an adult exhibits these criteria for more than 6 months, one can conclusively diagnose such criteria as being separation anxiety disorder. So here in this picture, we have a cross-section of the brain and the larger part of the limbic system, but we are going to concentrate mostly with the amygdala. And as you know that within the cross-section we are only having one here, though a human has 2 of them on both sides of the brain. In the front we have the frontal lobe, and then on the side we have on the left side we have the left temporal lobe, on the right side we have the right temporal lobe, and then on the top of the brain we have the parietal lobe, and then at the back we have the occipital lobe. So we are looking at the amygdala now, and this part of the brain is the key component to fear response. So when separated from major attachment figures, children with separation anxiety disorder may exhibit withdrawal, apathy, sadness, or difficulty in concentrating with work or play. Depending on their age, individuals may have fears of animals, monsters, the dark, muggers, burglars, kidnappers, all sorts of experiences that might simulate fear and represent danger. So when extremely upset at the prospect of separation, children may show anger towards someone who is forcing separation. So on the larger side of the limbic system, this is in relation to the connection between anxiety and separation disorder. So the limbic system plays a major crucial role because it regulates the behaviors we need for our survival, especially in managing fight or flight responses. During time of danger, the eye experiences light waves that are then converted into electrical impulse through the action potential. The visual thalamus then relays visual stimuli from the retina to the cerebral cortex. The thalamus is in charge of regulating many functions except smell. However, the impulse goes to the amygdala first, and then one reacts to the danger way before it appears visually in the eye. So those responses are sent to the amygdala through the brain cortex, which then alerts the hypothalamus, which is the central hub of the neuroendocrine. The hypothalamus, which is stationed just below the thalamus and functions to regulate autonomic nervous system, then produces hormones that causes the pituitary gland to secrete other hormones. The pituitary gland, through sympathetic system, once stimulated, then secretes hormones like cortisol or adrenaline as a result. So in this diagram, we are looking at what triggers anxiety and how the body responds to anxiety. Essentially, this diagram has been explained on the process of the limbic system and the amygdala. However, this impulse will come to the amygdala here first, and that is how you react before you even see the danger. That is how you react to a certain danger. So anxiety can really turn out to be dangerous, but some of the serious signs include when somebody is experiencing emotional distress, for example, someone is not eating properly, even they are not able to sleep well. Those are some of the signs that exacerbate anxiety because they bring along poor attention and focus. Memory is lost. You find that long-term memory is not, the mind is not able to perform recall functioning properly. And also the short-term memory, word finding, word salad, those ones are usually interfered with. Yeah, and when anxiety is so much to the brain, it usually the pituitary gland might secrete cortisol and also cortisol actually that would cause the risk of Alzheimer. Yes. So how does anxiety develop, or separation anxiety develop in children? Mostly you find that during the baby's milestone, when the child is growing, there are usually moments of separation from the attachment figure, like the mother, because the mother has to step out, the mother has to go to work. And during such periods, the children might develop either secure or insecure attachment. So children suffer from stranger anxiety at around 1 year of age. They don't really want to be with strangers, they just want to be with their mother. And then the manifestation of anxiety disorder will vary from age. The young children are reluctant to go to school or avoid school altogether. They don't want completely to go to school. Those who have taken their children, they know how it is difficult to have them settled during their first day in school. However, as children age, worries also emerge, worry of certain dangers like muggers, kidnappers, or even death. So still, because of such worries, there is anxiety that develops. Maybe children are anxious about on their way home from school, how whether they are safe, even at home, whether they are safe from all sorts of dangers. And also in adults, separation anxiety may limit their ability to cope with changes in circumstances. So According to DSM-5, individuals with separation anxiety disorder often limit independent activities away from home or attachment figures. So children will avoid school and they will have difficulty in sleep, especially when you ask them to sleep alone. They might not want because they are scared. And also later on in life, they may have problems when they are moving to college. And then some of the prognostic factors would include the environment. So separation anxiety disorder often develops after life stress, especially death of a relative or even death of a pet, change of school, parental divorce, moving into new neighborhood, immigration, and also young adults may experience separation anxiety disorder as a result of leaving their parental home and also when they enter into a romantic relationship and become parents because they are not schooled in parental roles, they might experience separation anxiety disorder. Also, parents themselves might contribute to anxiety when they tend to overprotect their children. They do not give them the leeway. They don't let them to do free association. And also when there is intrusiveness from parents also, uh, such um, situations are associated with separation anxiety disorder. Even genetic and physiological issues. We have had cases where separation anxiety disorder is actually genetically inherited when we look at the genogram. For example, we might find that the parent was suffering from anxiety and those hormones were transferred to the baby during the cross-section of genetic coding. So apart from separation anxiety disorder, we also have other types of disorders which are also falling into the category of anxiety disorders. We have the generalized anxiety disorder. However, the difference between generalized anxiety disorder and separation anxiety disorder is that the anxiety predominantly concerns separation from the attachment figure. So in generalized anxiety disorder, the person who is suffering from the generalized anxiety disorder does not suffer from separation. So they don't have a problem with the separation from the attachment figure, but the person who is suffering from separation anxiety disorder has a problem with separation from the attachment figure. So that is usually the major difference. So when it comes to panic disorder, so these are threats of separation and may lead to extreme anxiety and even panic attacks. So that is another form of anxiety, which is panic disorder. And we also have agoraphobia. Those with separation anxiety disorder are not anxious about being trapped, unlike individuals with agoraphobia. So people with agoraphobia are scared of being in areas that they might be trapped, like somebody might have the fear of lifts However, the person with the separation anxiety disorder does not have such fear, because they are just basically concerned with the attachment figures. So separation anxiety disorder is usually focused on the separation of the attachment figure. However, someone with agoraphobia has a problem when it comes to being trapped in a secluded place. So we also have the conduct disorder, and this is a truancy that can trigger school avoidance, and it's usually experienced by children who are actually already in school, and they don't want to go to school, or they avoid situations where they are told to go to school. However, in this situation, the separation anxiety is not responsible for the school absence, because somebody with the separation anxiety, remember, is just having a problem with the attachment figure. So moving on, we also have the social anxiety disorder. When somebody is refusing to go to school, maybe due to social anxiety or social phobia, this person doesn't want to interact with other people in the society, and that could be the reason why they are avoiding school. But that reason is not as a result of separating from the attachment figure. So we also have the PTSD, or the post-traumatic stress disorder, which is the fear of separation from loved ones. This is common after traumatic events such as disasters, particularly when periods of separation from loved ones were experienced during traumatic events. So the difference here is that in PTSD, somebody has a fear of separation if something happened to them when they were separated. For example, a lady whose husband has gone to war and probably did not make it back home might experience post-traumatic stress disorder as a result of the death of her husband, and this is not as a result of the separation of the attachment figure, who is now the husband. So that is actually just the difference. So in PTSD, the central symptoms concern intrusion about avoidance of memories associated with traumatic event itself. So the traumatic event will be the loss of her husband, and the separation anxiety disorder is not as a result of the attachment figure, but as a result of the loss of her husband. So other differences, other types of anxiety disorders include illness anxiety disorder. People with illness anxiety disorder worry about specific illness they might have. Main concern is the medical diagnosis, not separation from attachment figures. So there is bereavement, so intense yearning or longing for deceased, intense sorrow. And also we have the depressive and bipolar disorder, which is associated with reluctance to leave home. The main concern is not worry or fear of untoward events befalling attachment figures, but rather low motivation in engagement. So then how do we treat separation anxiety disorder. So the psychiatrists have come up with a method of regulating the mood through the boosting of the intake of serotonin through the synaptic junction, which is shown here. So the serotonin is usually works in stabilizing the mood and improving happiness and also the general well-being of an individual. So when the hormone is transmitted through the synaptic junction, then the person who is suffering from anxiety calms down and his mood is improved through the intake of serotonin. Yeah, so how do we deal with children who are exhibiting separation anxiety? So psychologically, it has been found that being positive around such children who are anxious is good enough and it appears to calm them down. However, you yourself as the caregiver or the attachment figure, you should not be anxious, because when you become anxious in front of the child who is also anxious, then the child will feel even more anxious and because you will be reinforcing the anxiety in the child. So just appear calm and be positive towards such children. Another way is you need to express gratitude towards a child's needs and expectation. When a child tells you they need to do something, you need to listen to them, show them that you care and that you are concerned. However, you need to slowly and deliberately push the child through a task, and as you do that, be empathetic, and by so doing you will be managing the anxiety of that child. Don't avoid tasks that make the child anxious, but instead work with the child in coping with anxiety problems. So how do we deal with anxiety in adults? One way is through breathing. Just breathe, because breathing is critical in regulating emotions that might trigger anxious feeling. Another method is through exercise. You need to exercise regularly, eat a well-balanced diet, practice systematic desensitization. If for example somebody is experiencing extreme fear, we can use a method like flooding. If somebody is afraid of a snake, maybe you can show them a plastic snake, slowly introduce them to the plastic snakes until they eventually touch them. Or if somebody is afraid of using the lift, you might ask them to come with you in the lift, and slowly by slowly they will get used to using the lift. Another method is to avoid burnout. You need to take time out between tasks and also reflect on what is triggering the anxiety. So in conclusion, anxiety at times is not bad because it helps us to stay in check and focus on the tasks ahead, thus keeping an eye on the prize. Anxiety also drives one relentlessly to discover their full potential. So overall, while anxiety has its own disadvantages, it also has its own advantages. Thank you.